Maintaining health and energy as you age. Sort of an interesting topic we're going to talk about tonight with Dr. Ron Kodras, who's joining me today. I'm Dr. Jim Heise. I'm Chief Medical Officer here at Door County Medical Center. And we're all aging, some of us more than others, as it turns out. And so it's always good to kind of talk about what can we do, what strategies and what sorts of things can we do, should we be thinking about to try and do the best aging we can, because obviously time marches on, and there are things that we can do to live a healthier, more meaningful life. And that's our goal for tonight, is to talk about some of those issues. So as I said, I'm joined by Dr. Ron Kodras, who's an internal medicine doctor here at Door County Medical Center. He has been with Door County now since 2017, and he brings to us a wealth of experience. He graduated. I'm going to grab his resume here because I don't have the memory to remember this, but he graduated, finished his residency actually from the Medical College of Wisconsin in 1985, and he got his fellowship in geriatrics in 2000, and so he's been practicing ever since in that field. And he has a lot of interests in those factors and the science behind what causes aging, how we can age better, and what strategies we can take. So what we're going to do is we'll do some kind of talking back and forth, and then as we watch, we'll see what questions might come up, and we'll do our best, or I should say not we, Dr. Kodras will do his best to answer the questions, and we'll kind of take it from there. So we're thinking this will be about a 45-minute long live discussion, and we'll see how that goes. So thank you so much for joining me.
Well, thank you for inviting me.
Really appreciate it.
Sure.
So, one of the things that Ron and I talked ahead of time about what should we talk about, and I know to me what was really interesting is there's a Harvard study on aging, and that's a great jumping off point because it kind of it gives us some interesting starting points to talk about. So why don't you talk about that Harvard study on aging?
So this recent Harvard medical school study said you could add 10 to 12 years of healthy life to the end of your life by doing these four things: never smoking, moderate alcohol intake, moderate to vigorous physical activity, and a healthy diet. I'd like to just kind of go on a little further in this, talk about the blue zones in the world. Blue zones are areas where the people live the longest. Okinawa, Japan is a blue zone. They have more people 100 years old or older than anywhere else in the world. And so the question is, what do you attribute their longevity to? Well, there's a couple important factors then. So first of all, they stop eating before they're full. They also have optimal nutritious diet. The other thing that's been found with blue zone people is that they're all in all more religious. They have a life purpose. They live with young and old together, and they have a healthy social network. So what I'd like to do is talk about that healthy diet, that nutritious diet that's discussed in both these areas here that I've discussed, and see how that relates to being healthy and living longer.
That'd be great.
So let me just kind of go a little further with that then. So first of all, what's the ideal amount of calories do you have every day? Well, that can change according to your age, your metabolic rate, your physical activity, and your size. So for men, they should have about 2,500 calories a day. For women, about 2,000 calories. Now, to lose a pound a week, if you feel like you're overweight, you need to cut down on your calories by 500 calories a day. That'd be 3,500 calories reduced per week to lose a pound. And a pound a week is a good amount to lose then. But what is the right weight for you? Well, there's a couple ways to look at this then. One is the way is to look at your body mass index. This is something, if you go to your primary care doctor, that's going to be checked out for you then. So a normal body mass index, which is your weight divided by your height, is 18.5 to 24.9. So if your doctor tells you you're in that area, you're looking pretty good. If you're 25 to 29.9, that would mean that you are overweight. If you're 30 and over, you're obese. If you're 40 or greater, you're morbidly obese. So what does that have to do with your health? We know that people who have increased body mass index, they have increased risk of getting diabetes. Diabetes increases your risk for getting strokes, heart attacks, other such diseases like that. So that means disability and an early death. However, there's one other thing you can look at too. More than looking at your BMI, you can look at your waist circumference. If you measure your waist around where your umbilicus is, you can find out if you're at risk for diabetes or not then. And a normal waist circumference for men is less than 40 inches, and for women is less than 35 inches. That'd be another way to see how your weight is and whether you need to do something about it. The next I'd like to talk about is some of the troubles that the United States is having with obesity and having diabetes. Back in the 60s, way back in the 1960s, diabetes made up about 1.8% of the population. Most recently, in 2018, it was 9.4% of the population. So it went from something being fairly rare to being almost 1 in 10 Americans having diabetes. Obesity back in the 60s was about less than 20% of the population. Now, I just heard it's 40% of the population.
Why do you suppose that is?
Well, I think it has to do with our diet and lifestyle.
Yeah.
And that's what I'm looking for questions from the audience on what we can do to change diets and lifestyle to help prevent getting overweight, obese, and getting type 2 diabetes as a result of this then. So we're looking for all questions that way.
So they always talk about insulin and when insulin is released and things like that. So is that something that plays a role in this, the body's insulin?
Insulin plays a key role with this. So the way you see is that with our diets, the way they are now, we eat more than 3 meals a day. Usually we eat breakfast, a snack in between breakfast and lunch. We come home from school. When you're a school kid, you get a snack, and then you get supper, and then you get some sort of snack then before you go to bed. What that means is that you have increasing levels of sugar in your body about the whole day then. To bring the sugar down, you increase the insulin production by your pancreas. The problem with that is that the higher insulin level is, the more you have problems with obesity. So insulin and insulin resistance causes obesity. There's an area in your brain that gives you your body set weight. And this is the weight that your body expects you to stay at. When you try to lose weight and you drop your weight down below the set weight, the brain will respond by reducing your metabolism by up to 40%. Also, it will greatly increase your hunger. So here you did all this work trying to lose weight. You got your weight down, and suddenly your metabolism slows down. Your hunger is going up. Hey, hard to keep the weight off then. So usually you gain the weight back. Now, if you can lower your insulin levels and your insulin resistance, your body set weight goes down. So when you lose your weight, much easier to keep it off.
That's great. So what kinds of things should we be thinking about or can we do? In fact, here's a question that Teresa has already asked, which I think is a good one. Can you speak to whether the keto diet is a good idea or safe?
Okay, so the keto diet is the hot diet going around then. So with the keto diet, it's basically a low carbohydrate diet. Carbohydrates are your starches and your sugars. So you're reducing your carbohydrate intake to about 20 to 50 grams a day. So that's pretty low. And you're upping your fat intake to about up to maybe 70%, and then the rest is protein, of course. Those are your 3 main nutrients that you get energy from then. So with this kind of diet, you're taking care of the problem with high sugar levels. So your sugar levels drop, your insulin levels drop because you don't need the high insulin level anymore. Your body set weight goes down and you lose weight. So you say, well, what can be wrong with the keto diet? The keto diet does work. It's hard to follow, to avoid carbohydrates so you're only getting a small amount of carbohydrates a day can be difficult then. Also, you got to remember that some important foods contain carbohydrates. So your fruits, your vegetables, all that's important for longevity because of the nutrients in it, you're going to have a hard time consuming those when you're limited to such a small amount of carbohydrates. And then people can complain about the ketogenic diet as far as causing brain fog. They get dehydrated easy. They can have problems with their sodium potassium level getting off. And so there's a variety. They can get headaches from it. Usually it takes a couple weeks to get used to it, and then you tolerate it much better. Now, so it can help you lose weight. You can lose a lot of weight with it, but it's hard to follow. So you have to read books on it. There are ketogenic foods you can get. You can go on the internet, ketogenic diet books. You can order meals, that sort of thing. But it's still difficult to follow. And again, you have to be worried about missing out on those fruits and vegetables that you're going to have to avoid to keep your carbohydrate grams down so low. But if you want to lose weight, it's helpful.
I know when I was doing primary care years ago, people would always ask the question, which I found really hard, and I know you have a special interest in this area, but people would say, what's the best diet? I mean, back then, it was before the keto diet. You know, you had the Atkins diet and the South Beach diet, which, you know, that sort of thing. And I always sort of struggled with that because it seemed to me that at the time that the Mediterranean diet was sort of the way to go, but I always hate the idea of different diets because they all seem to restrict in some way. And I always sort of felt that if you have to deprive yourself of something, that makes it much more difficult. So do you have an answer to that question? What's the best approach to eating?
Okay, so let me just go answer that question, but let me just talk about the Mediterranean diet for a moment.
Sure,
then.
yeah.
I think the Mediterranean diet is good. I think there's good evidence that it's helpful. It reduces your risk of diabetes and heart disease. And for most people, it's pretty easy to tolerate then. So you do have to exclude certain foods. But again, it's not a bad diet to be on. As far as diets that I recommend, I do recommend the Mediterranean, but I have my own diet plan that's kind of a conglomeration of several different diets that I put into my diet plan to make it more palatable. My main focus, though, is to help people out with their obesity, and preventing diabetes is my #1 goal. Also, I put people on my diet when they have diabetes and they want to get off medication. So if they follow my diet, they're going to be able to reduce their medication and improve their blood sugars then. So that's kind of my... I can review over some of my recommendations. So why don't I just go through a couple?
Sure, that'd be great.
Okay.
It's helpful.
So this is my diet and lifestyle recommendation for obesity and type 2 diabetes. So it says, no eating or drinking in between meals except for water, tea, or black coffee. It talks about no fast foods. Dairy products are okay, but avoid the dairy products with sugar in them, like ice cream. Okay to eat eggs. Basically, what you want to avoid is the foods that contain processed grains and sugar. So when you look at the ingredient lists on a lot of the foods we eat, you'll see that there's sugar, there's sucrose, there's dextrose, there's molasses, honey. These are all sugars. So you want to pick your food with as little sugar as possible. And as far as the refined or processed grains, we're talking about the 3 major components of our diet. And that's the corn, the wheat, and the rice. So you find those in all of them. And if they weren't processed, if they weren't refined, they'd be fine. What they do with these grains is they take the fiber out, they take the minerals out, they take the vitamins out, they take the protein out. So it's just a pure carbohydrate. Then they sprinkle in a little vitamins and they call it fortified. And that's what you're getting. So that's when you're eating white bread, pasta, white rice. You're having all the good things taken out. And what happens when it's refined like this, that it's just like eating sugar. So the body sees the white bread, the body sees the pasta, makes it into sugar like this. It gets metabolized very quickly that way. So I think that you want to avoid those foods that are prepared, like sweetened cereals, sweet rolls, cookies, cakes, most breads, muffins, chips, crackers, donuts, candy. Those are all filled with sugar or refined starches, and they won't help you if you want to lose weight or improve your diabetes. You got to avoid them.
You listed my diet. That's kind of a,
Okay.
but knowing full well that they're not, those things aren't healthy. But that's so true. Paul has a question which I think is good. Do carbs at night spike the numbers overnight? He says he's read that it's good to have a couple carbs before bed. What are your thoughts on that?
I think that if you're diabetic, there's a certain percent of diabetics, like 40%, who have a spike even without eating carbohydrates at night. They spike from their body preparing for the next day. It increases your sugars at night, so you wake up in the morning, you check your sugar, it's high, okay? So it's already spiking, so adding carbohydrates, I can't see that's going to be any benefit. Now, if you're on insulin and you're afraid of having a low sugar in the middle of the night, then sometimes having a snack before you go to bed can help prevent those low sugars, because you don't want to have a low sugar reaction while you're sleeping. So in that case, it'd be fine. Otherwise, no, I don't recommend carbohydrates at night. When you eat them during the day, you have a chance to exercise and burn it off. If you eat it at night, it's going to be converted into fat because you're not using it any. So,
yeah. Ann has a really good question that I was going to ask you about.
Okay.
And that is, what about fasting? Is it good to fast at times? This intermittent fasting, we've heard a lot about that.
So, intermittent fasting is another very popular diet. And let me just go through it a little bit then. So, the old-fashioned intermittent fasting was back in the 1970s. I can remember it well. I'm that old. So with that fasting, you would eat supper at 6 at night, and then your mother would shoo you out of the kitchen, and you couldn't go back there to snack. You couldn't have anything else to eat until the next morning at 7. So basically, you have 12 hours plus of fasting. And that kept our obesity level way down. It kept people from getting diabetes by doing that sort of fasting then. So that was just a 12-hour fast, and that obviously had benefit. Now, the newer fasting, you can start with 12 hours and then go to 16 hours. With 16 hours, easy to do. All you do is skip breakfast. So what would happen is you stop eating after your supper and wait till 12 o'clock the next day to eat your lunch. Now, with the 18-hour fast, you have 6 hours that you can eat, 18 hours you drink water, you drink tea, drink coffee, but no carbs, no foods. During those 6 hours, you should have 2 nourishing meals, okay? No snacking in between. But basically, during those 2 meals, you can load up on the calories, okay? Don't go crazy, of course, but you can load up on the calories. And that's found to be very successful for many people who tried that then. Now, other people will go to longer fasts. They'll do like 24 hours of fasting. Now, the longer the fast is, the more possible problems you might have. We know that as you age, every decade you lose about 10% of your muscle mass. In fact, by the time you're 80, you've lost 50% of your muscle mass. So, when you fast, you're going to lose some muscle mass then. So that can be an issue, especially if you're over 70 and want to do fasting. But if you exercise regularly, especially doing calisthenics or weights, you can prevent a lot of that muscle loss from fasting. But again, the longer you fast, like you go 24 hours or maybe twice a week do 24 hours, you're at more risk for dehydration, muscle wasting, and other complications for that. So we had to be real careful with that then.
Now, here's a question that comes from someone that shares your last name. So I'm assuming it's, I don't know. TJ asked the question.
All right.
Do you have a recommendation on how to deal with increased appetite as a result of increased exercise?
Okay, all right. So...
Who's TJ, by the way?
That's my son.
Okay.
All right.
I had to ask.
All right. So that's difficult. I mean, I think we've all noticed that we work out hard, we come back and we want to eat, and we want to eat everything then. So things that seem to help out with it is to drink coffee, drink tea, drink a lot of water, that sort of thing can help out. But, when the body's hungry, it's for a reason then. One thing that'd be important to do is make sure you're not loading up on the carbohydrates then, all right? Because remember, the carbohydrates are going to increase your insulin levels, and increased insulin levels can lead to being overweight or obesity, etc. like that. So again, eat more of the other food groups, and in fact, have something with fat in it. A lot of times will help you feel full, where carbohydrates, the sweets and the breads and the cereals, you can eat, feel full, and then an hour later you can eat it again. An hour later you can keep eating the carbs. Where fat, it's there for many hours, and you don't want to eat anymore for a while. So perhaps keep hydrated, coffee, tea, and then try something with fat in it rather than the pure carbs.
I've always heard people will say, one of the sort of easy tricks, if you will, is before you have a meal, if you're worried about overeating, is to have a glass of water right before, and it takes up physical space in your stomach, and it tricks your brain into feeling as though you've already had some degree of food, and so you may be more prone to eat less.
I think that's a great idea.
Yeah.
I think that's good. Other people say eat slow, because then your satiety will kick in before you've eaten too much. So eating slow and getting water and tea and fat really makes you feel full.
Yeah, I remember when I was in medical school, that was in one of the physiology courses, there was a lab that all the students had, and we all had to fast overnight, and then there were groups that we were divided up into groups of, you had a carb-laden meal, a fat-laden meal, a protein-laden meal, and then you measured your blood sugars over the course of the morning. And it was really fascinating because it just showed that if you had protein and some degree of fat, your blood sugars were a little more manageable, but you had this satiety, which is you feel satisfied. You don't want to eat more.
Yes.
Whereas if you had a breakfast of a sweet roll and a cup of cocoa or something, you'd have this big spike, and then you'd come down and feel really either hungry or just leaden. So that was just fascinating to kind of go through that and experience that. What I want to do is when people, when we talk about what is it about to be a geriatrician? Ron and I had a conversation, and one of the things that we're finding in this day and age, and I should say Ron more than myself, but I can relate to what he was saying, is that people don't think they want to go to a geriatrician because they say, I'm not old. I don't need to go to a geriatrician. And in many cases, that's true. I know as a fellow internal medicine doctor, I sort of joke to patients and say, I won't call you old until you're 90. And just because, my father is 81 years old, and he often says, who are you calling old? And it is just a number. But I think it's important to understand, there are, a geriatrician goes through an additional year of training. So and you obviously have a great interest and great knowledge in the role that nutrition plays in that. What other kinds of things does a geriatric specialist, what other interests do you have in that field?
Well, I think what I see as being a geriatrician is that I look at things differently than your regular internal medicine doctor taking care of an older person then. So I kind of view things in a way that I see people come to me and they have very complicated history, they have a lot of medical problems, they're on a long list of medications, and I look at it and say, is there a medication that we can remove? So I try to do the best I can to shorten that medication list. And I deal very well with complicated patients with a lot of problems, a lot of interactions with their medical illness and their medication list. So I try to help them kind of pare down that long list of medications they're taking then. So yeah, that's kind of one thing. And then, of course, I like to look into what I can do to help them live healthier and longer lives too. And that's some of the material that I can tell people about as far as preventing obesity and type 2 diabetes can be very helpful with helping people live a long and healthy life. So again, that's tough because I have to change their ideas on what's proper diet for them and what their lifestyle should be. But again, that'll help them out quite a bit.
Now you also have special expertise. You and Dr. Paul Board are involved in memory care. So when folks, maybe they notice, mom is a little slower mentally, or maybe is a little more confused, people will very often come to you for evaluation of that. Can you talk to us about what that's like? And I guess I'm also curious to know, do you find that there is any nutritional component to memory loss and to mental aging?
Okay, so the memory clinic usually has people who's referred to us by their family member. So usually the person won't be willing to admit or won't realize how much trouble they're having with their memory. So usually it's a spouse or a daughter, a son that's helping them come in to get evaluated. So when we see them, my main goal is to look for reversible causes of their memory impairment. So I look through their medication list, I look for metabolic illnesses that I can correct and help their memory improve. I look for thyroid trouble, vitamin B12 deficiencies, and that sort of thing to look and see if we can improve them. So we look at all the things that we know can be reversible and help their memory out. Then what we try to do is trying to put our finger exactly on what kind of problem they've got that's causing their memory impairment or cognitive impairment then. And then, we give them a diagnosis then, and then we try to help them out. Now, as far as medical treatment, there's not a lot for most illnesses that cause dementia. There are some that can be helpful, but I give people a handout on what they can do at home to improve their memory. To improve their memory, I talk about doing memory exercises, doing physical exercises, increased socialization. So when we talk, we use our brain a lot. I talk about supplements and vitamins that might be helpful. And then I talk about the diet they should be eating. And interesting enough, the diet I recommend is the Mediterranean diet. So that has the best evidence to be heart healthful and also help out with the memory.
Interesting.
So the Mediterranean diet. So, you recall the Mediterranean diet is mainly eating fruits, vegetables, and legumes. You eat cold water fish about once a week. And part of the Mediterranean diet is having some red wine, a small glass. I don't encourage that too much. And then the berries are recommended as far as, the blueberries, raspberries, strawberries, that sort of thing can be helpful. There's certain foods that are high in vitamin E, and that might be beneficial, such as almonds and walnuts and spinach and those sort of things. So we kind of go over the list of things that make up the Mediterranean diet, encourage that.
That's great. I know over the course of my career, it's been so helpful. Even in the hospital, in private practice, when someone is older and maybe mom or mom or dad, they're having increased falls or they're just not as active, and really having that extra pair of eyes in the geriatrician to be able to say, help me with these falls. What do you think of this? And there's just an area of specialization with that extra training that an internist doesn't necessarily have. And so it's really, so I think we're really lucky here to have geriatric specialists, because it's just like anything else, when you study more, you have knowledge on this. So it's been great. And the beauty of it is Dr. Kodras is more than available for any of those problems or concerns that you have. Now, Ann wants us to go back to, Kathy wants us to go back to nutrition.
Okay.
With regard to fat in our meals, What foods do you suggest in general? Are there, as far as, I'm assuming that means with regard to fat in our meals, what fats?
Okay. So I like to divide it into healthy fats and unhealthy fats. So the healthy fats are the like olive oil and avocado oil. So those are the monounsaturated fats, and so those are been found to be beneficial. And then the omega-3 polyunsaturated fats. So those are the two fats that are the healthy fats. Now the monounsaturated fats are like the olive oil and avocado, like I said, and the omega-3 polyunsaturated fats, that would be like the seafood and the fish, especially cold water fish and nuts, would have that kind of fat or oil in it then. And then the ones to eat less of would be like the saturated fats, which you find in dairy fat and animal fat. And then you would eat less of the omega-6 fatty acids. You will find those in the industrial seed oils, like the cottonseed oil, corn oil, soybean oils. Those are additives to a lot of our prepared foods, and they seem to have an increased risk of getting heart disease. So avoiding those kind of fats, those kind of foods, and having more of the good fats. So in fact, we kind of talk about, instead of all those carbs, eat more of the healthy fats.
Mm-hmm. Yeah, that seems to be. So I know there's an area that you've given talks on this area, and I find it kind of fascinating, and I think it's, I don't have a good grasp of it, but I think it might be good for our audience to hear, and that's an area, that's something that you talked about called epigenetics.
Yeah.
Can you kind of speak to that, and what does that mean, and what does that tell us, and what can we do with that information?
So epigenetics is a new area of study. It's been around for a couple decades, but they're just finding new information about it. So it's basically the study of changes in the DNA that alter gene expression but not change the DNA sequence. So in other words, your DNA, you got the 23 chromosome pairs, they have genes in them. A gene is like for your color of your eyes or for your intelligence or for those kind of things. And the genes need to be turned off and on in a certain way. So when you're an infant to mature to an adult, you have to have genes turned on at the right time and turned off at the right time. Most of the genes are unnecessary. So if you have a gene for growing keratin for your skin, you don't want that being made by your brain cells. So that's turned off. So that's all about what epigenetic is. Different ways of turning off the genes or gene expression. And there's three main ways to do it. There's DNA methylation, there's histomodification, and there's microRNA. So these are all ways that the body, when it needs something, will turn it on or turn it off when it doesn't need it.
So you got to explain those, because I heard a lot of syllables there.
Okay.
So what does that mean, and what do we do with that?
All right. So what I'd like to do, since that's kind of my favorite topic, is about aging then. All right. So just like you have a programmed events happening with your DNA, with the genes being turned on and off as you go from an infant to an adult, when you hit like 50 years old, aging increased by about 40%. And you get epigenetic changes where certain genes are turned off and on that you actually don't want turned off and on because it makes you age. And so this is not a random event, this is a program event that happens. But there are certain ways you can slow this program change, epigenetic change, down. And that's kind of what I like to just kind of go over with you then. So you can decrease aging by these things because they change your epigenetics. And a lot of it just makes sense. We already know they're healthy for you, like eating fish, chicken, fruits and vegetables, moderate alcohol intake, exercising regularly, higher education, higher HDL cholesterol, calorie restriction, methionine, which is amino acid restriction, and then there's certain other things that I could go over. These are things that are contained in like coffee, caffeic acid, EGCG, which is in tea, so those are all helpful epigenetically. Curcumin, which is in turmeric, that's that spice, and curry, and then omega-3 fatty acids and vitamin D. So these are all things that might possibly slow down these programmed epigenetic changes that make you age more. So there's other things that can increase the rate, and let me just kind of in general talk about them. So increased weight makes you get older epigenetically. Increase inflammatory levels in your body, increase your aging. Elevated blood pressure, that makes sense, doesn't it? Smoking cigarettes, air pollution, heavy metals, excessive alcohol intake, malnutrition, chronic stress, and sleep deprivation all have a negative effect on your epigenetic changes as you age. So
it's interesting. So it really has to do with either the food we're taking in, some of the substances we may take in, the environment that we're exposed to, all has to do with, it really gets down into the genetic level. I mean, that's always the most interesting thing to me is, as you said, you know, there are certain, I mean, the human body is such an amazingly beautiful and complex machine because at the cellular level, in these little microscopic cells, millions of DNA are doing their jobs, and they have to turn things on and turn things off at just the right time for those things to happen. And when we have, like you mentioned, heavy metals, let's say you're exposed to a heavy metal, and all of a sudden there's what we call a stop code, that something that should not have been stopped to keep us healthy is stopped. Yeah. And all of a sudden that causes disease and causes illness.
A good example would be smoking cigarettes. Mm-hmm. So the carcinogens, the bad things and chemicals in the smoke, get in your lungs, go to those cells lining your lungs, and it actually turns off, epigenetically turns off the cancer suppressor genes. Mm-hmm. Get turned down, and so you have increased risk of getting lung cancer. So you think of, how does our environment affect us? It affects us epigenetically. Yeah. And so doing the right diet, good lifestyle, makes your epigenetics better. And doing the wrong things, you end up getting cancer, obesity, and other problems like that. So it's interesting how your DNA is changing according to all the things going on around you, what you eat, right, what environment you're exposed to, whether you exercise or not, your body is responding.
Interesting, because it really does, that sort of explains, you know, when you go to a doctor and the doctor says, eat more fish, and you sort of say, okay, you take them at their word, but there's a lot behind those recommendations as yes. we're talking about. There's yes. There's reasons to go all the way down to the molecular level and the microscopic level that affect how the body works. And as time goes on and as we learn more and we have experts like Ron, we're finding out those things that we can do that help us live a longer life. I mean, I think it's clear that a lot of the things that have happened over the course of the last number of decades, I mean, we know so much more now than we did in medical science. I think, I never remember the exact numbers, but I know it was relatively stunning to me that in 1900, I think the life expectancy was about 42 or something.
Yep, yep.
And now is it 80 yet? Has it hit 80, or is it still in the 70s?
It's like 79 for men and about 83 for women.
Okay. Yeah. So it's amazing the longevity, and we see people, the number of 90-year-olds that we'll see in the hospital at any one time is quite something. Not because they're deathly ill, but just because normally you would, even from when I started 15 years ago or more, you know, you had people in their 70s, 80s in the hospital. Now you have people in their mid-90s.
Yes.
So it's really quite something.
Yes. So in my practice, I see people of all ages, 50s, 60s, 70s, 80s, but I'm seeing more and more who are 90 plus and doing okay with it. So that's really nice to see then.
Yeah. And that really is an area too where, you know, we always talk about, that's kind of a cliche, but I think it's true. I mean, age is just a number. And, you know, and I'm sure Ron can testify way better than I, that we've seen people that are in their 60s who don't look a day over 91, and we've seen 95-year-olds who don't look a day over 60. And it has all to do with, some of it is luck, but a lot of it too is how people choose to live their lives, and if they've managed to skirt disease. So it's always good to know. I think it's great to know that we have you as a resource, so that if you're interested in finding out, hey, I want to live the best life that I can in the time that I have, what can I do? I think that's always a great option. So I think we're starting to wrap it up. So any last minute comments you'd like to make, or plugs, shameless plugs for yourself? Because I'll give you a shameless plug when we're done. But
okay, oh, that's fine then. So, so I have plenty of handouts, and I have very happy to discuss longevity, things that you can do as far as diet and lifestyle that can help you out that way, and for different medical problems, rather than just medications, I talk about other things you can do for it then. So, and I'm always trying to cut down the number of pills people are on and try my approach of diet and lifestyle.
Yeah, and I don't have anything more to add to that. I mean, I think that I think is the big thing, is being able to, the thing with medicines, let's get rid of the medicines if we can. That would be, that's so great, and having someone that really can look through and do that is really the way to go. So thank you so much for joining me and for educating all of us as to these things that can hopefully make our lives more meaningful and a little longer. So should we do the COVID handshake?
Okay, here we go.
All right.
All right.
Thank you so much. Thank you all for joining us. We really appreciate it. I wish you all the best and stay well.